meant for an adult audience. Loveline may contain sexually oriented content. Listener discretion is advised.
Loveline with Adam Carolla and Dr. Drew.
Hey, everybody, it's Loveline. I'm Adam. That's Dr. Drew. Phone number 1-800-LOVE-191. Dr. Drew, board-certified physician, addiction measure specialist.
Mm-hmm.
The Macho Man, Randy Savage, is in here tomorrow night. Kelly Osbourne is in here on Tuesday night. And then Eric Balfour? Yeah.
Mm-hmm.
Yeah, from Texas Chainsaw Massacre or something.
Mm-hmm.
Yeah. All right, what's happening, buddy?
I just saw that Windy City Heat. Had a good time. Are they going to re-air that?
Windy City Heat, which is a show we produced, a movie for Comedy Central, is on tonight. And I think they'll probably re-air it.
But, you got to put that out on like DVD or something.
Funny,
Seriously.
right?
Funny.
Well, here's the thing. I don't want to blow my own horn, but as I've said many times, Jimmy had a lot more to do with this than I did, and so did many, many other people. So I'm not blowing my own horn. I just happen to be one of the producers of it, but it didn't go much further than that, and a little cameo in it. But the movie, you see a comedy to laugh. If you see a solid comedy, you're lucky if you get 8 or 9 out loud chuckles going throughout the course of the hour-and-a-half movie. This movie has 20, 25, 30 good laughs.
Were you laughing uncomfortably? Hard.
Yeah, hard.
Yeah.
You look around, you make a snort, and then you hawk up an oyster. It's funny.
How was your weekend otherwise?
It was fantastic.
Oh, really?
How was yours, Drew?
I got a sick kid at home. It's been freaking me out. And
what's going on over there?
He's got an infected arm from poison oak, and that's been stressful. And caught my daughter laying a few prime words down on the internet.
Oh, really?
Oh, yes.
Typing?
They spend hours in these instant messaging
Chat
things.
rooms?
No, the instant messaging.
I am. How's that work? And how'd you bust her?
Oh, we print and read. we monitor, and she lets us.
Now, how does it work?
How do you do? Has what?
She does the IMing.
And there's a memory.
And she's talking to somebody who?
Her friends, school, this kind of thing. And then,
all right, she's talking to people she knows.
And then she got a little fight with somebody.
And she got a little spat with somebody.
And started laying down some language that was.
And she was typing.
Oh, yeah.
She types?
Yeah. Oh, like crazy.
She types like crazy.
Yeah.
Like an Asian secretary.
Absolutely.
And then.
So you're
going to give me an eating disorder, by the way, if you do too much monitoring.
No, we print it up. And
how do you print up?
Sitting downstairs watching
you go to the computer.
And my wife knows how to get the history up and print it. And she throws up 6 pages at me, and she goes, read it and weep. I'm sitting there watching the UCLA game.
What kind of language is in here?
Oh, a few good.
The F-bomb?
Oh, yeah.
F-bomb. S-bomb?
Oh, yeah.
How about the MF?
Oh, yes.
bomb?
Yes, that was.
Really? That was a prime word, huh?
Used
a lot of MF.
Yeah. Not a lot, but it was used in a way that was like shocking.
Yeah.
So we had a little.
That must have been comfortable.
We had a little discussion.
Listen, I've told you this a few times. Kids swear their asses off. The F word is the first word I learned.
You know what I learned is if you don't if you don't make explicit what is not okay, they're going.
Oh yeah.
So there was a consequence, pretty severe one, and then
what was the consequence?
Just had a little talk and a little
timeout,
time room, yeah.
No using the computer.
How long? That was that. I didn't let her get back on to tell everybody that she was signing off and she's in trouble. And that's
busted.
Look, motherfucker.
Yeah, Drew.
Where do you think she gets that from?
You got to lead by example.
But the deal is,
do as I do, not as I.
We had to sit all three of them down and go. You don't here's the rules. This is it. Now we know rules we got to make. Unfortunately, you don't think of them ahead of time. You know.
Yeah. Did you come up with some substitute words for MFer?
No. Yeah. Those.
Okay. Yeah. All right. Well, they're not.
I think I was sick, and I had Rush Limbaugh's with his opiate addiction. So every goddamn news agency in town was talking to me about that.
I heard him apologize or explain on his radio show the opiate addiction, and it sort of comes off like so many explanations / apologies that you hear in the media, which is when it's done, you realize, oh, he didn't do anything wrong, or according to him, he never apologized for anything. He said, I heard him. He said he had a back operation. Back operation was botched. Yeah. Didn't go right.
This is every opiate addict thinks.
Yeah.
So. Okay.
So, but here's what he says to the people.
Yeah.
So I had to take these pills, or either have another back operation or live in pain. So I chose to take the pills for the pain.
But then he said, I got badly addicted. I'm not a hero. I'm ashamed of myself. I'm willing to get treatment. I'm trying to be honest about it. That's all kind of above the board stuff.
I didn't hear that part.
Yeah, it was like a 20-minute thing.
No, I just heard like
yeah. No, his
seconds.
thinking on it is all off, but you can't expect it to be clear at this stage of the game.
All right. Now,
But it's
who
good
we talking
times.
to?
We were talking to somebody you hung up on, evidently.
How'd I hang up on her?
I don't know.
I think she hung up.
Let's see.
All right.
Are you there?
Yeah.
Oh, no, that's not her.
No, I just hit 10. No.
Yeah.
Who do you want to go?
Yeah.
Mm-hmm. Allie,
Hello?
you're 14.
Yeah.
What's up?
Like 3 weeks, I gotta kind of speak slow, quietly. 3 weeks ago, I lost my virginity, and we didn't use a condom,
Sure.
and he didn't come.
True, that's...
And Mom, close
Sweet.
the door. Mom, close the door. Get out. No, get out. Get out. Get out.
See what you got? About another 6 months.
Now listen, Allie.
My
Yeah, I
mom
know, Allie. Listen, if my daughter says get out, I swear to God, I'm taking the phone and screaming into it.
No, because if my mom found out, she'd probably kill me.
Isn't it going to be weird, though, when your daughter calls you, Drew? I lost my virginity. This
Oh, my God.
guy almost split me open.
Hello?
Drew?
Allie, I'm listening. I'm
Dr.
listening.
Drew?
I'm listening.
All right,
Allie,
go
Yeah.
ahead.
you sure you want to be doing this at 14?
Yeah. I don't know. I regret it, but
Yeah, okay. How old was the guy?
he's 14.
Oh, my God.
And he's a complete ass. He does not even talk to me anymore.
All right, well, stop. Don't do this anymore. Why are you doing this
I
at so
know.
young?
Well, I don't know. Like
That's
I
old
always
these
went
days.
to.
I
Drew.
know,
That's
but it's young.
old.
Well, I always went to a Catholic school,
Yeah.
and like as soon as I got out, like I went out with like the biggest, like horniest guy, and then ever since then I've been kind of acting out.
Okay. What'd your mom do? Leave the country, or she's still
No.
in the house?
Where's your dad?
He was in Philadelphia.
At least he's out of the state.
He's-
But aren't you worried your mom has a glass up against the door?
I don't know, but she was not even around me until the second I walked in. I was like, oh, I had sex. And I was like,
All right. When did your dad leave?
well, I used to live in Philadelphia, and we left him like
Okay.
What's up with him?
How long ago?
when I was like 6, and I moved out to California.
Is he an alcoholic or anything, Dad?
No, he was just, I don't know.
All right. Hold on a second. Let me tell you, we hear this every night on this show, which is Dad basically gives up on raising the kid. Mom, they moved, I know, but Mom is there raising the kid, cooking the meals, checking the report
Doing
cards,
the work.
checking for the instant messages and the F-bombs. And Mom walks in the room, get out! You know what I'm saying?
Yeah.
This is what I love. I love teenage daughters kicking the crap out of their poor, beleaguered mothers who've been doing the best they can to sort of get up, make sandwiches, and then go to their work full time
And the
all
final
day.
insult is idealizing the mother,
That's right.
the mother effer that
I'm
took
going to
off.
stay with Dad in Philly.
Oh.
Yeah, I know. That could be you, Drew.
I'm so happy to be talking to you guys. Like,
We're glad to be
you
here
guys
for
are my
you, Allie.
idols. Like,
Thank you.
oh my God, it's making me crazy right now.
Well,
Thank
now,
you.
your dad was a bad guy, right?
Oh yeah, he's a big asshole,
Okay,
and
do
like
you see,
Good.
barely calls me anymore.
but do you
and,
see
like,
how you're
he's
acting? Why don't you get a little? There's a lot of great therapists in Arcadia. Why don't you get some treatment for how you're feeling?
I have a really bad like cutting problem and everything. Like,
Does your mom know about that?
yeah, she knows about that.
Are you getting treatment?
Yeah.
You got to, Allie. Why not?
I know. I'm seeing like a counselor, like my
Hey,
school counselor.
Allie, can you do me a favor, too? Give your mom a break.
I know.
Poor woman is doing the best she can with
I
you.
know.
She's trying to be a mother and a father. Your dad's tilting a couple of tall ones in Philly right now.
He's been
Finally
married
got
like
his,
5 times too.
Oh my God.
Got his
I
fifth
know.
wife on his lap. He's an a-hole. Your mom is a saint. She's trying to discipline you. She's trying to create some boundaries, and you're
Yeah.
yelling at her. Now, give her a nice big hug, would you?
Yeah, I'm afraid she's in the other room listening.
Well,
On the
now what the
radio.
last you have a question though about the.
Okay.
you had.
I
You
just
got to get. When did this happen?
September 25th, so it was like 3 weeks ago.
Oh my God. Why didn't you get the morning after pill right away?
Because I'm so afraid she's listening. Okay.
She's 14, that's why.
Yeah, it's hard for her to get it.
No, she's stupid.
Well, because he didn't come inside me.
It doesn't matter.
Yeah, well, it helps.
It helps.
Yeah, I was like, I called my friend up that night and I told her, and then we went to a drugstore the next day, but I was so afraid I could not buy. I was like shaking.
Listen, Allie.
Planned Parenthood of this problem.
But you're probably not pregnant.
I don't think I am, but
Okay, but good. You've dodged a bullet and learned a valuable lesson.
yeah.
Now, go tell your mom you love her.
Stop
Get that
this.
morning after pill for 5 years from now when you have sex next.
Yeah. Yeah.
Yeah?
Yeah. And stay with the therapy.
Stay with the therapy. Yeah. Dad's with his fifth wife. These guys have no idea what they do to their daughters. The sons somehow get by unscathed. They just end up playing football and getting a few fights. But the daughters, they're a mess. God bless you, dads. Oops. Did I hit the wrong one?
You're fine.
Joey?
Yes, this is Joey.
You're 23?
Yeah.
Yeah, what's up?
Well, basically, I've been trying to figure out whether I want to continue a relationship with somebody that is not out. And I'm fully out, and as far as him, he's not out to his parents or his friends, and I feel basically like sometimes I'm pushed away or pushed aside. And
I'm a homosexual.
How old is he?
Yes.
How old is he?
He is 34.
Oh. Not out yet.
No, and I am his first experience with another man, and I've basically tried to put myself in his shoes, but...
What was he doing before?
Do what?
Was he married or something before?
No, basically he's just held up all of his sexual experiences, and basically he's felt like he doesn't... He doesn't want to be with a woman. I know that.
Yeah, but this guy's really been struggling with this for a long time. It's no wonder he
yes,
wouldn't
and
want
I
to
was his very first sexual experience.
Really? All right.
Well, he's told me that he's kissed a girl before. That was when he was like 15, 16, and
Okay.
but he's
Like his
never had
father or
intercourse.
Yeah, this guy's a mess.
He's a mess.
Yes.
Why do you say that?
Because he's 34 and he's never had a physical encounter with another human being past kissing.
That is abnormal.
When he told me that, yeah, I did think that was kind of abnormal and crazy. But then I put myself in his shoes and I realized that maybe it's not all that abnormal.
It is.
And
Okay, let's all put ourselves in his shoes. It is. It's abnormal.
I kill myself by putting myself in his shoes.
And it's probably because some sort of trauma in childhood, some sexual
Something's
abuse.
up with him. But be that as it may, does he live in the same town with his parents?
yeah.
How close does he live to them?
Probably be about 30 minutes away, but they own a business together.
Oh, boy.
So he's got to go in to work every day with them?
Yes.
All right, that's going to be some pressure.
Yeah, I used to work for him as well.
Yeah. Well, listen, I'm not so sure you can get somebody to do something that they don't want to do, especially when they work with their parents, and especially when they're 36.
34. I think you just
34?
got to accept, let him do it in his own way, in his own time, and you just,
It's not that I want him to do something that he doesn't want to do. It's just I want to be a part of his life more than what I already am. And I
that
don't
may
think,
not have anything to do with his parents.
Yeah.
well, I don't think that's going to be able to, blossom unless he does come out with his
Yeah,
parents.
but, if he does come out, his parents may fire him.
And, well, I don't think that's going to happen, but...
Well, okay. How long have you guys been going at it?
Well, going at it, I'm not sure. But we've been together for about a year and 2 months.
That's what I call the gay relationship. I say going at it.
Going at it, well...
Heterosexual, I say going out. But
You
with
say
gays, I
humping,
say
too.
going at it. So it's been over a year.
It's been over a year, yes.
And he's in love with you?
Yes, he's verbally told that to me, and I've definitely told that to him as well.
All right.
All right.
I am in love with him, and
Well.
I just don't know how we can continue a relationship when I'm out and he's not, and I feel
Well,
like...
what about it? Does his parents see you two together?
No. No.
All right. So, on one hand, it's like, well, let the guy do whatever on his own time or don't pressure him. On the other hand, they've been together for over a year.
How much longer his parents can be around?
Oh, you saying he should kill his parents?
No, just wondering how much longer.
Joey,
Yeah, I'm here.
how old are his parents?
Probably in their 50s. I think 50s or 60s.
That
gonna be a while.
could be a while. All right, what business is he in?
He's in a... I don't know if I should say that.
All right, fine. I'm bored with my own question. All right, so here's the thing. What do you do? It's been 14 months.
I think you just keep going. It's uncomfortable. You keep asking for more, but
What? You set it? Do you set a time?
I don't know. It's hard to say because it's not like their intimacy is suffering.
Okay.
They have a real intimacy. It's just the range of their life experience is sort of restricted, and he feels sort of bad and sort of it's sort of a self-esteem issue for our caller.
Cut him
I feel
off
like I'm
sexually. How about that?
Yeah, that's what we do to.
And listen, do you really want that? I mean, you know what I mean? Do you want to go over to Dad and Mom's house for Thanksgiving and have Dad giving you the stink eye across the table and the brother who's just back from, just got thrown out of the Marines for fighting with a superior officer, getting drunk and like, hey, Barry, you're blowing my brother. And you know what I mean? Like, did you even want that?
And it's because evidently Joey had a good experience when he came out. He's expecting, well, if you just come out, everyone will be fine. Not necessarily so.
I'm not.
I'm
not so sure Joey had a great experience when he came out either. But that may not be the situation. All I'm saying is yes, their parents may reject him. They may reject you. You may end up getting a guy who's been fired from his parents' business or excommunicated from their life and now resents you and looks at you as the cause of this.
And just because he tells them doesn't mean he's more comfortable around them or that, again, you're going to get this sort of openness that you're looking for.
No,
he doesn't seem capable.
It's not like he'd be high-fiving with his dad. Like, hey, did you get some last night? Oh, yeah, give him a good cornhole. That's right. Oh, I taught him well. You think you're not going to get that? I wouldn't. Okay, I wouldn't want it if I was Joey. All right, Nicole.
Yes,
You're 23.
I am. My problem is I've developed a rash under my left breast, and I just don't know if it's something that will go away or if I should go see my doctor.
Is it red right in the crease?
It started out red, but now there's like little bubbles.
Is it right in the crease?
Bubbles.
Yeah, and it kind of goes around from like the middle of my chest to like the side of my back.
All the way into your back.
Yeah.
It could be shingles.
What size are you?
My breast?
Yeah.
36B or C, I think.
It's basically one of two things. It's either shingles.
Don't know your cup size?
Well, I haven't really bought a new bra for a while because I'm poor.
I
So
see.
no.
Well, that's poor, huh?
I'm going to start a program called Bras for Broads. This is women who are working, who are single mothers, who are students who don't have enough to buy bras and have outgrown the cup size that they formerly had.
Can I be the first recipient?
Yeah.
Thank you.
But I got to know B or C.
I'm pretty sure I'm up to a C now.
C, 36C?
Yeah.
You're calling, you're from the Portland area?
Yep.
Okay, we'll rush some out to you.
Okay, thank you.
All righty. You an underwire girl?
I am an underwire girl.
You like the snap? You like the hasp in the front or in the back?
In the back.
In the back.
In the back.
Yeah, they moved to the front at some point, and then they moved back to the back again. Am I right, Nicole?
It was in the front when I was about 14, and my dexterity was kind of off.
Yeah.
And then it just kind of moved to the back.
Yeah, somebody started the bra off by putting it in the back, and that seemed a little difficult for the ladies. And then somebody thought, hey, I'll put it in the front. That's where they were when I was in high school. I remember my friends telling me where they were. Yeah, Drew was like the Fonz. He just, snap, bra comes bounding open. Yeah, he had like a genie garage door opener. Drew knows the movement. I don't know. It's there's a little finger blasting mixed with dreidel spinning. I don't know how it works, but just pow, it comes right off, right, Drew? Okay, but the point is now they've moved the clasp back to the back again, right?
Yeah.
Yeah.
Crazy. But listen, Nicole, it's one of two things.
Nutty. It's total insanity.
Work for it.
Yeah.
Nicole.
Yes.
Does it hurt or burn?
It hurts really bad. It's
That's
hard to
shingles.
sleep because
It's
whenever I
shingles.
move-
It's shingles. You've got to go see a doctor.
Bubbly though, maybe it's herpes.
But shingles is a herpes virus.
Ooh.
What
And
is shingles?
it's a herpes type virus that causes a rash basically it comes out in a nerve, in a single nerve distribution. That's why it goes all the way around from the back. And it inflames the nerve and it causes a lot of pain. And when the rash goes away, if you don't take medicine during the time when there's a rash, the pain you're having now can be permanent.
Oh, damn.
It's very uncomfortable. So there are yeast infections also under the breast that can get a little bubbly, but that's right in the crease, and it doesn't really hurt. It kind of burns a little bit. But if it hurts a lot, then that's shingles.
Okay.
Hey, Nicole.
Yeah.
Before I send you out the bra, I'm going to let you clear up the shingles so we don't infect the new bra, okay?
I appreciate that.
Well, now she
All right.
especially needs the new bra so she can dispose of the old ones.
Yeah. You may have to go braless for, let's just say, the winter, but it should come out by the spring.
I've been braless for about the past 2 weeks.
Because of the pain, yeah, sure.
Yeah, I can't. I mean, I go home. When I'm at home, I'm topless completely. Cause it's
You're going
Nice.
to need Zovirax,
Sweet.
Valtrex, Zovirax, Famvir. These are the medicines for that.
Good
high,
times.
High doses.
All right, we're going to take ourselves a little break. When we come back, we'll speak to Jennifer. She's 18. She invited a 22-year-old coworker over one night, and now he won't leave. Keeps asking? What's that mean?
Keeps asking to come back, I guess.
All right. We'll take a quick break. We'll be right back. Hey, everybody, it's Loveline. I'm Adam. That's Dr. Drew. Phone number 1-800-LOVE-191. Dr. Drew, board certified. Blah, 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 blah. The Macho Man, Randy Savage, in here tomorrow night. Kelly Osbourne in here on Tuesday night. Just the love.
Maybe.
The hosts find between each other. Our guest tonight. I was watching, one of my favorite shows is a show on HBO called Autopsy. It's like Autopsy 6, you know. Always makes me mad when they give them the number designations, because I always seem to start at 6 or 14 or 27. And I'm always like, I love this show. Where'd the other 15 go that I missed? And where were they? I watch HBO every other day. I never saw one, and they run things to death. But anyway, this time, then they do these sort of police forensic stories, but it's by real pathologists. And they wait a minute, not it's pathologist. Okay, so the point is they did an actual autopsy this time.
Oh, you don't normally see them.
They normally don't physically do the autopsy. They just interview the guys and show the crime scenes and stuff like that. And it's pretty graphic. But this time they're cutting into the chest plate, and they got that electric pizza cutter out and stuff. And I had to turn my head. And,
really?
Oh,
You're
yeah.
a pussy. I didn't know that.
Huge puss.
Oh,
they got into the brain and stuff.
Yeah, he's unsaw.
Yeah, no, not for me. You know why? You know what this is? I work around too many power tools, and it bothers me to see when I see tools going into flesh. I think of an accident on the job site.
I see.
But as long as the guy's dead, wouldn't it be fun to see what a 16-penny nail would do to him?
What is weird is when you're struggling with a patient, you're struggling, and then they're dead, and then you go do the autopsy.
Yeah, you've been hanging out with them for a month, and now you get the pizza cutter out.
That's a little weird.
You're cut right into that chest plate. Can't we just run people through scanners or something? And here's the other thing, too. We do a lot of exhuming of bodies, you know. They dig up bodies all the time. It's like her first husband, once they found out she'd given the cyanide to her last husband, well, then they had to look into her other husband who died in 1974. The body was in relatively good shape. They always do that. They're always digging people up. Look, why don't we just put them in a Ziploc and put them somewhere with a tag on them or something? We keep digging them up.
Why don't we, keep samples, like the Egyptians did, in little jars, and leave the body behind?
Yeah, I mean, that's just got to be a huge pain in the ass, not only for, the grieving family, but just what about the poor schmuck who's getting $8 an hour? Hey, Bob, yeah, get the backhoe. What do you mean? He's been in the ground for 22 years, have been manicuring his Yeah, we're bringing him up. I'm going to need you to pop the lid on it. They always do that. They always pull them up, and they're just fine. I mean, they're dead, but other than that, they're fine. They're like, yeah, the body was amazingly well preserved, and we got tissue counts. It was high levels of, and they just do that every time. Oh yeah. Here's the other thing I watch on those shows too. They got these. They had this one guy was the angel of death. He was the the mercy killer, the hospital guy.
Oh, yeah.
Everyone who was in there got hooked up to life support. They killed him,
Yeah.
And they popped him for killing 2 or 3 people, but he could have gone as high as 50. And, he could have been one of the most prolific American serial killers. But I still bet the other serial killers who basically just, kill 15-year-old prostitutes kind of scoff at him.
Right.
Yeah. What'd you do? Tweak his breathing tube? Yeah, that took a lot of work. Sure. I got a van where I had to tint the windows and pick up prostitutes on the street. Cops all over the place. What'd you do? Just pull someone's trach tube out? Give me a break. That's nothing. But I mean, it must not garner a whole lot of respect in the serial killer community. But here's the thing:
when they have their conventions.
Yeah, welcome serial killers. What do you do? What'd you do? The guy was 94, and I pulled a catheter out of his dork, and he bled to death. Yeah, nice. My granddaughter could have done that. All right, so here's what. This guy's killing everybody, and they always do this. The serial killers always do this. They go like, look, I don't want the death penalty. It's weird that they're so enamored with death. It's like their whole life is death. But then when it comes to them, they're pussies, you know? They're like, I don't want to die. Really? Seems like almost something you'd be looking forward to.
No, you got to understand something. When people do that kind of thing, other people do not exist. They do not exist to them.
Well, because they're dead. Yeah, I know what you're saying. Yeah, they can't. So these guys always do this thing where they go, look, I know there's, you got me for killing 9 people, but I don't want to die. There's another 20 or 30 people I killed that I'll tell you about, if you agree not to kill me.
Wow.
And they're always like, okay. And then they tell them about the other 40 people they snuffed, and they're like, all right, what do you like? What do you want to get the
yellow salad?
You get the chicken, or are you allergic to anything? Balsamic vinegar or anything? Because you get some cable. What do you like? Like Showtime or Cinemax? That's it? Oh, now he's confessed to killing the other 40 people? Well, we can't go back on our words. I mean, please, word could get out in the serial killing community that we were two-faced, fork-tongued. I say we just kill them anyway. Can we just do that? This other great one, this is an amazing case. This woman, she's young, she's like 20, marries this maniac in Canada. But the guy sort of looks like the 7th member of Duran Duran. It's just like his white guy. He's like 23. He's got that sort of flock of seagulls kind of look to him. And this guy's a homicidal maniac. He kills her sister, rapes her sister, her younger sister, sodomizes her right in front of her, makes her go down on her sister for a birthday present. It's like insanity. She marries him 2 months later. It's a 15-year-old sister's dead. Starts killing a bunch of 15-year-olds. Then, so at a certain point, the woman comes to the police, and after he gets caught, and says, "Look, I'll tell you everything that this guy did. I just want, you got to cut me a deal." And they're like, oh, "Okay, well, we'll cut you a break. Just tell us everything he did." And she tells him all these gruesome, horrible stories. They would kidnap 15-year-old women and sort of keep them barely alive while he did horrible, unthinkable acts to them. She was right there the whole time, but she played that I was scared sort of thing. But I, by the way, I'm done with that. The whole part where you're scared for your own life and he's raping the 15-year-old in the bathroom. Go ahead and step out the front door and start screaming bloody murder, would you?
Yes.
I'd like to hold you somewhat culpable for this as well. But then they find a bunch of videotapes of these horrible things he's doing, and she's there laughing the whole time. But they're like, yeah, we already cut the deal with her, so she's cool. Really? What about the videotapes we now found? I mean, we cut the deal before we found all the videotapes where you stood around handing the guy towels while he raped and killed people. We're not going to factor that in? Or can we just go back on our word just a little bit? What's your word mean to a serial killer? Really? Is there some problem here?
Oh, but you'll be as bad as a serial killer. You'll be just as bad as they will if you lie to them.
Really?
You would be, Adam.
Is word going to get out in the serial killing community?
What is the logic of that?
I don't know. Yeah. I would instruct all my people to cut everyone deals. Like, listen, we're setting you up on you're going island in the Bahamas, and I'm going to get you hookers. And what do you like? You like pineapple? Pineapple? They're going to take those rings of pineapple, put them around your penis, and give you oral sex while they eat off them. Beautiful underage Polynesian women. Just tell us one murder. Just one. Just one. Okay, kill him. Kill him. That's what I do. And their thing would be like, see, the police are like, yeah, but if word gets out that this word would never get out, he'd be dead. No one would know about my Polynesian vacation promise. Oh, we do this all the time. There's just all this. You don't know all the deals these guys cut with everybody. They get 2 guys. One guy kills half the people. The other guy kills the other, and they cut a deal with the guy. We'll be easy on you. Just help us with your buddy. That's nice. That's
a nice topic for that.
Yeah, it's nice. Huh? Jennifer?
Yes.
You're 18?
Yes.
Oh, yeah. So you invited your 22-year-old coworker over one night.
And
he won't leave. He just kind of stayed.
He stayed in your house?
Yeah.
Is he still there?
Yeah.
Adam will get him to leave for you.
How long has it been?
About 3 weeks.
Oh, my God.
He's not left your house in 3
No.
weeks?
Yeah, and I told him that he cannot stay there and he has to leave, and he just won't leave.
Put him on the phone with us.
I left.
Oh, you left.
Oh, you're out.
Oh, yeah. I'm going to stay at my parents' house.
Does he like you?
I have no idea.
You don't know whether he is interested in
I
you?
think he does, but I don't know.
What
I
was
don't
the
want
sort
him there.
What was sort of the presumption of what he was coming over for that first night? Was it for dinner or something, or just hang out, or?
We went out and got drunk and then, came back, and I told him that he could stay the night, and I went to class the next morning and came back, and he was still there, and he's been there ever since.
Do you see him at work?
Yeah.
Hold on, Drew. Shut
You
that
have a
stupid
call. You have
book.
a call coming up about this.
I don't want to look at that book. Drew got the crazy anatomy book where they lop off everyone's penis and there's this weird vaginal with like tongues in them and stuff. Come on, Drew. All right. Wait, did she see him at work or not?
Didn't answer.
Yeah.
You do?
What kind of work
Yeah.
you do?
I work in a restaurant.
Yeah. This is typical restaurant behavior. And what's he say to you? What's his story? If we talk to him, and don't tell us, I don't know. If I got him on the phone right now and said, look, what are you doing? That's not your house. She wants you out of your house. What would he say?
And he lives there?
He's
telling people that he lives with me.
Now, are you guys boyfriend, girlfriend as far as he's concerned?
No.
Have you ever had sex with him?
No.
Have you kissed him?
No.
What?
Did he agree to pay rent?
No.
Is he psychotic?
I think.
Why don't you call the cops?
Is that what I should do?
Yes.
Absolutely.
I hate calling the cops, but call the cops.
Absolutely. We know all the Culver City guys. They'll tell us about it.
Yeah, call the cops. Just tell them to get this guy out of there.
You've asked him to leave. He's squatting. It's your house. You pay the rent. Your name's on the lease. He's gone.
Is your name on the lease?
Yeah.
Is it an apartment?
Yeah.
And you're just renting it yourself?
Yeah.
No roommates or anything like that?
I have a dog.
Don't you have any male friends or anything that can go get him out of there?
What about just some of your buddies go over there and kick his ass?
No, I just moved up there to go to college, and I really don't know anyone.
No one at work?
People I work with.
Well, what about them? What's their feeling on this guy? What about your manager at work?
I have no idea.
Well, you got to
We
tell
have
them.
no idea.
there.
You see your manager,
I
right?
mean, one of Jennifer's the psychotic one.
Wait, has she asked him to
I'm
leave?
not.
Yeah.
She says she has been explicitly telling him to leave.
Wait, what's he do? He's a bartender or a
He's a
busboy?
server.
He's a what?
A server.
Server. Okay. You guys have a manager, right?
Yeah.
And he's able to go to work during the day?
Yeah.
Call a locksmith, and when he goes out to work, change the locks.
He
Jennifer?
doesn't have a key.
So how does he get in and out?
He's just there. He just won't leave. I don't know.
You said he goes to work.
Yeah.
When he goes to work, lock the door.
Okay.
Why is that so hard for you?
Because I'd have to see him at work.
Then you tell your manager that you're being sexually harassed.
Okay.
Okay. When does he? You know everyone's shift, right?
Yeah.
All right. Next time he has a shift, you go to work or you go home and you lock him out and you tell your manager that's where you are.
You tell him ahead of time. You tell your manager exactly what you're going to do. You know, it takes
Something's
two.
up here.
It takes two to tango. You know what I mean?
Well,
This guy knew he could take advantage of Jennifer. Jennifer cannot come to her own defense at all.
God
It's
knows
amazing.
what he's doing to the dog sexually.
Oh, yeah.
You know what I mean, Drew?
The dog?
Yeah.
I didn't hear her mention a dog.
She has a dog. Jennifer,
Yeah.
do you have a dog?
Yes.
Is it at home with that sexual predator?
No, it's with me.
Okay. Good.
I'm
What
in
kind
my
of
car
dog is this?
now.
Can't that dog attack him?
It's a Chihuahua.
Yes, it can. There you go.
It's all they do. Or are they just bitchy to their owners?
No, to everybody. Except predators, interestingly.
Yeah, you know what would be a nice pay-per-view for me? Just,
Chihuahua chucking?
yeah,
Chihuahua
but
chuck?
I was thinking kicking.
Kicking.
I was thinking taking...
How about just punt, pass, and throw?
Yeah, that's good.
Yeah.
I was thinking it's punt, pass, and kick.
Kick, I beg your pardon.
I would like to see some international soccer stars and some some old style NFL kickers, the ones that not the sidewinders, the straight ahead kickers
with the big toe,
big steel toe in there, and just pow, just
When did that go away?
Tom Dempsey style, pow, just chihuahuas just being teed up, and we see who can make it. Even the best chihuahua in the world, still, I would laugh like a hyena, which is my next competition. They're going to be harder to kick.
Hyenas, yeah.
Chihuahuas, don't eat them. Let's just kill them all. One bullet, get rid of all of them. They're that small. Drew.
Yeah.
What do you want to know?
Forgot.
Right.
When did they get rid of the steel toe stuff? The NFL.
The soccer kick style kickers start coming in about the early 80s.
But doesn't it seem like bringing back that steel toe would be a way to extend things a bit?
I think they made the kicking shoe illegal.
Yeah. That's what
all right. We'll take ourselves a little break. We'll talk more about NFL and more about penal codes and what we should do with serial killers. All after this. Hey, Buzzaboo! I'm Adam. That's Dr. Drew. Phone number 1-800-LOVE-191. Randy, the Macho Man Savage, in here tomorrow night. And Kelly Osbourne, who I saw sing a song at the Playboy Mansion a few weeks ago, but I was so toasted by then. I just...
Nice.
I didn't even really remember where it was.
You were served up the next day to me.
Yeah. Let me tell you something, too. I'm thinking about a lawsuit because I was overserved. I was definitely overserved, and someone has to pay. You see?
Good.
Because after the first 5 or 6 highballs, I can't be responsible for the number of highballs I drink after that. And again, when you're overserved, you got to blame somebody, and it ain't the person in the mirror. I'll tell you that right now. God, was I hungover the next day.
I know. You were a delight. Delight.
That was a mess.
Yeah.
Oh. Karen,
Yeah.
you're 17.
Yes.
What's up?
Okay, I have a question. I guess I'm like not normal down there.
Mm-hmm.
What's the problem?
Well, I didn't like think anything, but like a boyfriend that I was with for like 2 years had said something like, he said I was a normal. I went to the doctor and she said like I had like enlarged inner lips or something.
Mm-hmm.
Well, Adam, here's a picture of that. It just so happens. And there's a surgery. That they look how nice it looks afterwards.
What's the first picture? What's the trouble picture?
There and here.
Oh, man. I don't even know what that was. It's like a huge wad of chewing gum and pigeon crap and just balled it all together and mashed it onto someone's crotch.
But here, look, this is after the operation. This is after the operation. That's good, huh?
Yeah, it's tough with the glare, but yeah.
Anyway, there are aesthetic labia procedures
Let's close that book, please.
That people will do that seem fairly successful. Mm-hmm. And if that's something you want to do, that's something you can consider later on. But
how about just growing? Well, let me tell you something, ladies. Guys do a lot of work with beards. What I mean is you see that fat guy who grows a beard and then carves it in and essentially carves himself a jawline?
Chin, yeah.
You see the guy with the real weak chin, he grows a goatee, looks kind of good. Mm-hmm. How about you just train that hedge over that stump? You know what I'm saying?
Yeah, about as explicitly as can be said.
Well, I just mean you got an old stump out in the yard. It's not good looking. Raccoon's been chewing on it and whatnot.
Train the ivy over it?
Train that ivy right over it.
There you go.
How about that, Karen?
All right, well, I'm just like, I don't know if like another guy would like freak out or...
No, that'll be fine. Listen, guys, no.
Well, they're not huge fans of it, but love is love.
They're just happy if you're there.
They do have surgeries, though, as Drew pointed out.
No, but I think they're real expensive.
Probably.
Well, by the way, there's no cheap surgery, right?
No.
What's the cheapest, Drew?
I imagine like a wart removal or something.
Yeah.
Yeah.
All right. Karen?
Yeah?
How about getting a wart removed from down there?
Okay.
Evidently, that's pretty inexpensive. All right, so here's the thing. If a guy, this is how you know if a guy's in love.
Yeah?
And guys aren't that, they don't care what's going on down there.
No.
You're fine. But again, you could use a little of the hair, right?
Yeah.
Could you?
Karen, relax. You're fine.
Yeah.
Relax.
Yeah. Yeah, guys don't mind a little hair down there.
No, they're fine.
They're fine. I don't trust the guys that don't want any hair down there.
No, it's a little weird.
It is, right?
Yeah.
Thank you.
Vindicated, I'm sure.
Yeah. Look at these magazines where all the ladies have extra hair.
What do they call that?
Extra hair.
1976 Playboy?
Melissa,
Yes.
you're 20?
Yeah.
Oh, Drew, we got to take a break?
Okay.
In 6 minutes.
Oh, really? Oh, we're on this side of that thing?
What are
Okay.
you talking about?
I forgot which break we were in.
Yeah.
I thought we were running late.
No. We had the 40-minute break.
Hey, what's up there,
You
Melissa?
have never done that before. That's pretty good.
I know.
Wow.
You know, maybe
And you were hungover last week.
No.
It still affects you. 1 week. 1 week of cocktails.
No. I had
Yes.
kind of a couple cocktails tonight. What are you
jeez.
talking about? I'm back.
All right, Melissa, what's up?
All right. Well, I met my boyfriend when I was 14, and we had sex when I was 15. And I really don't think I've ever had an orgasm, and I'm 20.
You still with the same guy?
Yeah.
Have you been faking?
Yeah.
God bless you. God bless you.
But the
girl.
problem with faking is it doesn't urge the guy on to performing, to try to find his way to the
Yeah,
orgasm.
it'd be like if a teacher was faking the test scores and just putting an A at the top of every time a guy handed in a D
You just hand him
paper.
blank papers.
You start scribbling some stuff, stick figures on it, and they just put a big fat A and hand it back. Doesn't make you work, yeah.
Well, the thing is, I didn't fake it for 2 years, and then he started wondering if it was totally him, and I don't really think it's him.
Did you
I mean,
you start
it's not
faking
like-
it that night?
Huh?
Did you start faking it that night?
Yeah.
And
That's nice.
what is it
Well-
with guys? Now I believe. Come on, you believe that?
Well, it's called serendipity, buddy.
Oral sex, Melissa?
No, I'm kind of afraid of it.
All right,
Ooh.
well, that's the missing
Kind of creeps
ingredient.
me out.
Well, yeah, me too, but I do it. God knows. But seriously, why does that creep you out? I mean, you've been with this guy for 5 years, 6 years.
I know. I tried it when I was 14, and then all of a sudden he said, "Ooh, bad smell," and it kind of put me off.
What I love about women, and let me tell you something about women. Women are so stupid, Drew. All you got to do is, it's almost like they're like dogs. You get to screw with them one time, and that's it. It's like one guy gets there in 14, he's like, ooh, that's funky. And that's it for the rest of your life? No oral sex? The thing that women crave most?
Imagine, just switch it around and make it a male now. Girl goes down there and says, "Oh my God!" What would the guy do?
Now I have to get as much. Now I have to quit my job and go on some sort of oral tour where I'm obsessed with receiving oral. That's what guys do. They would get more oral.
But they would certainly just say, yeah, okay. So
Yeah, get down. Get busy. Listen, what do you think? You got Rose Garden down there? Start sucking. That's what a guy does. Please. I love the fact that it's so easy to just. It's like, well, I almost drowned in a pool when I was 9. I can't look at water anymore.
Again, it speaks volumes about the motivational priorities of the brain, how different they are in the men than the women.
Yes.
I also had a seizure when I was 12, and I've never eaten tuna because that's what I ate before it.
Okay,
Yeah,
so
seizure's
you're
a little more of a powerful negative reinforcer, I'd say.
You're what we would call simple.
Yeah. You think you had seizure from tuna?
Well, I know it's not from tuna. It just kind of put me off tuna. I never really liked it anyway.
So now the fish smells especially traumatizing to her.
It's ironic that tuna is the.
It was just traumatizing because I woke up 40 minutes later in a ambulance with throw up all over myself and not really seeing anything.
Okay, but good times. Well, look, you're going to need some oral, sweetie.
Okay. The other question I had was...
Yes, please.
I've masturbated, and I'm not sure I'm doing it the right way because I never really go inside. I rub the outer...
That's
outside.
what you want.
Outside's where the action is. Outside is fine.
You're doing it.
Fine?
Yeah, but you're not having an orgasm, right?
Well, not during sex, and it's just kind of...
No, but what about during masturbation?
Yeah, it's not excruciatingly big orgasm. Like, I've never really had that wow orgasm.
All right, no, listen, you're breaking my heart. You're having an orgasm,
She
right?
may not be. She may not be. She probably isn't.
Melissa's 20.
Yeah, I was like talking to a 15-year-old. That's all right. That's good.
No, it's good. No, it's good. It's better. It's good. No, it's great. Melissa,
Yeah.
do you think you're having an orgasm when you masturbate?
Yeah, well, there's the build-up, and then there's the release, but it's not really satisfying.
Are you on medication?
Triliptol.
It's possible that's affecting this. You on that for your seizures?
Oh, yeah. Yeah, she says. Yes.
Melissa?
Yeah.
Are you on the trileptal for seizures?
Yes.
That's kind of an unusual...
No,
wait. Wait a minute.
Oh.
Do you have pseudo seizures?
No, I have a partial complex.
Partial complex seizures. All right.
Yeah.
Mm-hmm.
All right. Well, good times. Trileptal doesn't usually cause problems.
What's a pseudo seizure?
It's
That's like a fake orgasm, right?
Kind of. It's more complicated than that. It's probably the way people that have been traumatized have panic attacks. Frankly, that's my theory about it.
Okay.
It looks like a seizure, but there's no seizure activity in there.
Well, let me say this very quickly before we go to break. All you simpletons out there who just like, hey, I tried this once, I don't like it, or I associate this with that, or whatever. It made me vomit one time. First off, if I did that with booze, where would I be now?
Wouldn't be as drunk as you are tonight.
That's right. I got right back on that booze horse. Let me tell you something. I vomited all over myself when I was 15. I fell asleep in my own driveway.
Yeah.
Woke up my feet hanging out of a shrub.
It's still pulling gravel out of your face.
I had gravel in my face when I finally climbed into bed the next morning. But did I quit boozing?
Of course not.
Hell no! I didn't quit boozing. You people with your tuna. I ate some tuna. Now I can't eat anymore. Please, eat that tuna. Let him eat that tuna. Let's all get along. We'll be back. Everybody, it's Loveline. I'm Adam. That's Dr. Drew, the Randy Man, the Randy Man, Randy Savage, the Macho Man. Although the Randy Man,
We'll call him that tomorrow. See how he likes that.
yeah, that works, Drew.
Maybe the missionary position.
Like taters. And French fried potatoes. Ate them with my sling blade. All right, so Randy Macho Man Savage in here tomorrow night, and Kelly Macho Man Osborne in here on Tuesday night.
You know, Jack was in the Olsen twin film.
Jack Osborne?
Yeah, he and I flew up one time together.
Really?
Yeah, he did a good job. He's got it in for Mary Kate.
Oh, sure.
Oh, yeah. So Kelly actually told me that.
Does he know which one's which?
He could, yeah.
I watched a little Full House over the week.
God. Oh, my God.
These girls were like, must have been 1.5, two,
yeah.
and they're hitting their marks and they're acting.
Yeah.
They're like, give me 5. And the audience goes nuts. Must be weird to have just like, this is what you grow up with. Somebody says to you like, okay, I need you to walk out on stage when we're going to tap you on the shoulder. You walk out, stop, look at Joey, and say, no, you didn't, okay? I know you don't know what that means. But the audience, so you walk out and you go, no, you didn't. And the audience just goes nuts. Everyone starts clapping. And it's insane. Like, you're 2 years old. How do you process that? What's it mean? Yeah. How come no one's clapping when you're at home and you say something? Oh, my God. Oh, yeah. I know. Just say, you know, they must have been just like little birds. They just went out, just repeat. Just please repeat this. They couldn't read it or anything.
No. Just somebody have to be out there going, say it again, say it. Okay, do that.
Give them a little Olsen treat. What if they had Olsen treats? It would be like Scooby. Amanda?
Yeah.
You're 18?
Yes.
What's up?
Basically, I cannot get a guy. Really stupid, I don't know. And, like, I don't know, I called a Dateline, but you need, like, a credit card, and there's always a little sex thing attached to it, too, for whatever.
Wait. You're 18 years old.
Yeah.
Right? You live by the beach.
Yeah.
And did you go to high school there?
Well, I went to high school there for a year, and then I went to Wyoming, and I came back. I called a while back because of the throw up on the dick thing.
The what?
Threw up?
I called, like, I don't know, like a year ago. I was the one that threw up when giving head or something.
Or something? In Wyoming?
Well, yeah. I was the blind chick that called, like...
Blind?
Yeah.
All right. And now you're in California and you're having trouble getting dates.
Yeah, I've had trouble getting guys my whole life, but I don't know, and everybody always tells me to go out and do things. I have no way of doing things. I can't get a ride anywhere, and, like, I don't know.
Wait, they call you to do things, but they're not willing to pick you up?
No, people tell me that I need to get out and do things, and I can't.
So are you totally blind?
Yeah.
So what do you see?
I
It's
see
just...
lights and crap. I see, like, shadows of things if they get close enough to me, and, like...
Oh, you do?
Yeah.
Do you sleep with your eyes closed?
Actually, my eyes go kind of all around my head, and I can't control them unless I actually close them really, really tight. So, yeah, I sleep with my eyes moving around.
Moving around?
That's what I was told, anyway. I have, like,
Okay.
Tourette's.
You get one of those eye shades, because it freaks people out when they see that.
Well, I don't know. I don't know really. I don't think it's quite that, too. I don't know.
Okay.
I think I'm just cursed.
No, I just meant for when you're sleeping. I don't mean for during the day.
Yeah.
You're
Would it fall
cursed.
off?
What do you mean you're cursed?
I am, I guess. I can't have relationships, and I don't know why.
Well, look, here's the thing. You're 18.
Yeah.
It's feast or famine when you're 18. There's about 20% of people that just have more relationships than they know what to do with, and a line forming at the rear.
Yeah.
And then there's others
Everybody else.
who's just everybody else, just awkward and can't get off the ground.
Yeah.
And then you meet somebody, and then you get some confidence, and the next thing you know, you're in great shape.
Well,
And then
it's
they
not even
break
confidence,
your
it's just-
goddamn heart, Drew. They tear it out.
It's not even the confidence.
Yeah,
You
sure.
learn what you want, what you're looking for, what
That's
fits,
right.
what works.
I know what I want. I just can't get it.
What do you want? Now, does a guy have to be attractive?
Well, I have to be attracted to his personality, but I don't care what he looks like.
I know you don't care what he looks like, but like look at it this way, and you're not a guy, but a guy goes out with an attractive woman 80% of the time so he can show her around to everybody else.
Supposedly my boobs are attractive, so I should have guys.
Oh, your boobs are attractive?
Supposedly.
Well, you can figure that out, right?
Well, yeah, but I don't go around touching people comparing their boobs to mine. I mean...
Oh.
Yeah, but the guys do it, and they tell you that.
Yeah, but...
All right.
Well, other girls tell me that, but sometimes, I don't know. I can't
Okay.
figure it out.
All right, well, let's figure this out. Now, do you read Braille?
Yeah, and I listen to books on tape because actually going through a Braille book takes way long because it takes longer to read Braille.
I listen to books on tape, too, because I can't read.
Well,
But
I just
same-
I can't figure it.
Same thing as Amanda.
are you able to work?
I'm able to work. The system, though, will not get, like, the system, I'm actually going to have to change systems because I'm probably going to end up living in California because I'm waiting for a letter from the Housing Authority in Wyoming, and I'm on SSI. My DVR counselor, who's supposed to pay for whatever equipment, computer reading equipment, whatever, if I get a job, she meets me twice. One meeting, she leaves, like, way, way, way early, sees me for 10 minutes. She thinks I can't do anything. Like, she means basic. She wants me to go to a learning center, which is where mentally retarded people go to learn things like, cooking in the microwave, doing laundry, things I already know how to do.
Yeah,
For,
but
like,
why don't you
4
take,
years.
Amanda, why don't you start taking some direction?
Yeah.
There are people who are professionals who've given you some advice, and
Well,
you know better.
She keeps telling me to call her in 6 months, call her in 6 months, call her in 6 months, and
Okay.
that's all she tells me to do.
No, wait, where do you live now?
Well,
You live with somebody?
I'm with my parents right now, waiting for a letter from the Housing Authority from Wyoming. I mean, I'm in California right now.
All right, okay.
And I'm
So,
probably going to end up living in California because I won't get the letter from the Housing Authority.
okay, so here's the thing. I agree with Drew. You need to take whatever opportunities present themselves, and I know some people seem like they have a bad attitude, and they do, because these people are underpaid and they're overworked, and they don't really care.
They just
They
wanna
don't care.
be
Okay, they
better
don't
than
give a
everybody else.
ass.
They
I
don't care as
agree.
much as you would like them to.
All right, but listen.
But they know.
But
They know what
let me
you need.
explain something to everybody. Money motivates people. And all you people that are out there doing jobs where nobody pays, like you're a school teacher, you're helping the handicapped, you're picking up garbage, whatever it is, you don't find a bunch. A, there's not a bunch of money, and B, there's not a bunch of people appreciating what you do. There's no incentive. Once in a while, some angel comes in and is willing to do this kind of stuff. But these are good people. Don't get me wrong. But they're not. You know, the people that call you all the time are people that are trying to sell you something. The people who don't want your money, they call every 6 months, maybe. You know what I mean? Unfortunately, you can't expect the same performance out of them as you can out of guys trying to sell you a car. That's all.
Yeah, the motivation may not be as intense, but on the other hand, this is a professional. She knows what Amanda needs. Amanda doesn't know what Amanda needs. Take some direction.
Oh, Amanda,
it's not working Amanda.
Amanda needs Amanda, but and what about some sort of group, some sort of blind singles something?
I don't even know. I don't think they have those. Not that I know.
They gotta have
And I want
groups.
a sighted guy. So
You want a sighted guy? Yeah, you need a sighted guy. You need
Yeah, I
nice.
do.
You need a husky guy with bad skin.
How did you lose your sight?
Okay.
How did you lose your sight?
What? I was born blind. I have optic nerve hyperplasia, which is where your optic nerve doesn't develop.
It's never that lab fire that I always hope for. It's always something kind of, I was just born that way. All right, so you never did have sight?
Nope.
Okay, so you don't even know what good looking is?
No.
All right, you're fine then. But again, don't you want someone who's nice looking so your friends go, ooh, he's cute?
Well, I don't have any friends.
Oh, okay. Well,
I
screw
wanted
them.
somebody that I like and that likes me and was willing to give a crap.
Okay. Well, let me say this real quick. I know it all sounds horrible for Amanda, but I would argue that there's a lot of people that are willing to be friends with blind people, with handicapped people of all kinds, and who would be willing to date them and whatever. There's a whole segment of the population that actually is looking for that.
Yep.
In sense that a guy who's...
Most of them are women, though.
Okay, but there are... Okay, that's true. But a guy who's having a little trouble in the chick department, who's had a long dry spell, is not going out with the head cheerleader, I'd go out with the blind chick. Oh, I'd with a set of big cans, but I'd be like... I'd be lying constantly. She'd be climbing into my Chevette and be telling her it's a Cadillac.
Ferrari.
It's a Ferrari. I have to put in a cassette that had a Ferrari sound on it. There are guys out there, people who want to be your friend, and there are people who want to date you.
Yeah.
They're out there.
Yeah.
You shouldn't be that closed off.
That's
There's
right.
something going on. They're good
Amanda.
people out there.
Yes, absolutely.
Thank you. All right. Melissa,
Hi.
you're 19?
Yeah.
What's up?
I was wondering if, prolonged drug use and eating disorders can lead to, diabetes.
Yeah? Why? What's happening?
Well, I've been, having to pee all the time, really tired, feeling, fatigued, maybe low blood sugar.
Yeah. Look, are you overweight?
No.
Are you way
No,
underweight?
I'm, average.
But you're bulimic.
And not anymore, but I was for 6 years.
And when did that stop?
5 months ago.
And what drug were you using?
Everything.
Well, good times.
Yeah.
Drew, what about being bulimic when you're, 13 to 19? I mean, those adolescent years.
Yeah.
I mean, could that screw you up forever?
Yeah.
It should.
Change your growth and things,
no.
yeah. Growth and development.
How are you doing? Are you okay? I mean, beside that?
You mean, physically?
Yeah.
I feel a little, run down, but I'm okay. I'm not, particularly unhealthy.
It's not the typical situation you end up with diabetes. So you ought to get checked. It's a very simple thing, very simple blood test.
I've been to a lot of doctors lately for all sorts of things, and all the doctors are horrible. I can't get one doctor I can just talk to straight and say, I know that these things are wrong with me, and, what does that mean? I can't find a doctor who, is, knows
Drew,
anything.
what's wrong with your profession? What's going on? Insurance companies? Lawyers?
Well, I'm on HMO. I'm sure that has something to do with it.
They don't have any time for you? They don't
Yeah.
want to talk? You got 3 seconds per patient?
That's right.
You get a minute now? Drew says now, because of the HMOs, he's not permitted to speak to his patients. He has to nod.
That's
He gets 2 nods. He can either do a no
do hand signs
or
to
yes.
assistants.
He's like a third base coach. He goes to his belt. That means high blood pressure. You do the arm thing. It's
Grab
anemia.
the bill
right?
on my cap.
Well, that's the indicator.
Yeah.
That lets them know that a sign is
Sign's
coming.
coming, yeah.
So you go to the cap.
The
that
belt.
means sign on. Then to the belt, it's high blood pressure.
Arm diabetes.
Diabetes to the arm, but you can wipe off the diabetes by going across the chest.
But do it above the epigastrium. It's coronary disease.
Coronary. That's all right.
Ulcer.
pointing. Yeah. All right. And then now what about hands on the hips?
Hepatitis.
Hepatitis. C.
Ulcerative colitis. Let's
Ulcerative colitis is hands on the hips.
Yeah.
All right. So if I go the bill, that's the indicator, right?
Yeah.
Then hands to the hips.
ulcerative colitis. UC.
All right. Again, go to the bill.
Yeah.
That's the indicator. Swipe on the arm. Diabetes. Again to the bill. Go to the belt buckle now.
Hypertension.
Let's say swipe to the other arm.
Ulcer.
I didn't give the indicator.
Oh.
I'm just saying, if you don't see the indicator, then we wipe the sign off.
No move.
Okay. All right, hey, Melissa.
Uh-huh.
I'm glad we could help.
But wait.
Oh.
But Melissa, so you don't have diabetes, right?
Well, I haven't been checked, but I was just
You've been to multiple doctors and you haven't been tested?
No, I've
It's the simplest test in the world.
no, I've gone for different things. I just haven't thought to ask of that yet. But I just think like most of the doctors that I've talked to like can't give me a straight answer about anything.
Why do you think you have diabetes, and why?
It just came up because I've had all these like weird symptoms, but
With the fatigue and the frequent urination is part of that.
Yeah,
Well, wait a minute, I got it too.
Well, yeah, but you got prostate problems. But
Oh, yeah.
Melissa, have you had blood tested at any of these doctors?
Yeah, I have.
Okay, I guarantee you they checked. Did they take a red top tube?
I think it was blue,
Blue or purple?
but I can't be positive.
If it was red, they took blood sugar. I guarantee.
Oh,
you.
okay.
So
Red top tube. That's a scratch.
Scratch the nose.
Scratch your nose.
Bill, scratch
Go
the
the
nose.
bill, then scratch your nose.
Bill, ear, purple.
Ears purple, top tube. All right. So swipe on the arm.
Both knees leukemia.
Okay. That's great. It would be nice if you could just signal in, especially if you have bad news. You got to talk to some family and tell them their daughter has leukemia. It's like, what's he doing? He's gone to the bill. Now it's both hands to the knees. Ooh. It's rough. And you could even have one for like apologizing or something. It'd be nice, Drew. You never have to talk to any more of your patients. All right. You take that. I'll take this. Devin?
Hey, Ace. What's up, brother?
You're 21. What's going on?
I just wanted to let you guys know I've been listening for about 8 years. I got about 600 love lines archived in my collection.
Wow. Oh, do you?
Yes, I'm truly a collector. I listen to a lot of talk radio. I'm obsessed with it. And there's not a better combination of personalities and entertainment than you guys.
Well, thank you, Devin.
I'll take you guys above anything, you know.
Where are you calling from?
I'm in New York now, and I'm dying because New York misses you, you know. You're not on here anymore.
No, we're not?
No. I called you guys in the night you guys were off. It was about 5 months ago.
I sort of remember that.
Yeah.
And we should be on in New York.
Yeah, I'm sure it will.
Yeah, you should. I gotta call my friends in Seattle and have them send me tapes. It's pretty bizarre.
Oh, no.
That is wonderful of you.
Just call Westwood One and get them to sell it in New York.
Yeah, it's crazy. And Drew, I loved your book. The story of Amber. That was as good as, Fitzgerald, anything like that, you know.
Oh, my Devin, I love you.
Ella Fitzgerald wrote? It's amazing.
Scott.
Wow, Devin, you really know your material.
I truly appreciate what you guys do. It's kind of embarrassing when I have to record your show all the time, when I'm going out with friends and stuff, but I just really love what you guys do.
What are you doing in New York?
I'm a music student. I study jazz.
Wow.
Wow.
I want to be Devin. Sit and
Wow.
listen to Loveline.
Gets to sit and listen to Loveline and play a flugelhorn.
Wow. What's your instrument?
I study guitar.
That's awesome.
Jazz guitar, not.
I love that jazz guitar. That's real guitar.
Yeah.
Nothing better. That big hollowed out one. It's electric, but it's sort of acoustic. It's real smooth. It's the guitar of 60s porn. Yeah. You watch porn.
Isn't that a mark of distinction? You glad to know that?
Watch porn from the 60s. A lot of that swinging cool cat guitar in there. All right. Hey, Devin, geez, thanks. What can we say? Do you have a question?
Yeah, I actually do. I kind of made it entertaining for the screeners, but basically my question is that because Brian, he always wants to cut people off for whatever reason. But
Devin's got a relationship with Brian going here.
Yeah.
It's good.
Well, only like once. I recognize his voice, but no big deal. But anyway, basically, when I have sex with my girlfriend, I'm uncircumcised. And
the way jazz guy says it. Yeah.
The foreskin comes back, and it gets very dry, and it's kind of painful.
During sex or subsequently?
Beyond the fact, the next morning
Later,
I wake up and I got to walk around for the next day, and it hurts like a bitch. I don't know.
Right.
Yeah, because here's the deal. The head of your penis is not used to having any friction, really.
But it's not the head; it's the foreskin. It's coming.
It's the exactly. It's the foreskin coming back. It's well beyond where it should be, and I can't get it back.
It's getting pulled.
Is it narrowing where it's tough to get it back, or tough to get it back over the head of the penis?
It seems like it folds over. You know what I mean? Like I gotta kind of stretch it outwards.
I'll tell you one good way to stretch it. My dad used to do this. He played the horn. He would use a trumpet mute. You know what the mute is, Drew?
Yeah.
Yeah, but that's the plunger bottom. The mute actually sticks into the thing and gives it that real high pitch.
Oh, right.
40s gumshoe kind of.
Yeah.
Yeah, use the end of that. So it's just about right, that cone-shaped thing.
On the penis.
You stretch the foreskin over the mute.
I see.
Yeah, do you have access to any mutes?
Not that I could put on my foreskin. I have.
But wasn't there a trombone mute too?
Yeah, I think there was. So whenever
two.
they give that real high pitch sound to the trumpet or the trombone, it means they had a mute in there. Hey, Devin.
Yeah, Adam.
I'll tell you what you need to do. You start pulling that foreskin back over the head of your penis, and
like in the afternoon, right?
Yes, regularly.
Yeah, when you're not having sex, just pull it back and walk around your apartment in your underpants with it back that way.
And you need to be sure there's not a yeast infection there, so you might want to get some Lamisil or Lotrimin, something like that, and use a little bit of that on there. Keep it super dry. Before you do any of that, though, I would suggest you get some hydrocortisone cream and make sure that the inflammation is sort of dealt with. Just put some hydrocortisone on, keep it dry. If that clears it up, fine. If it's still kind of irritated, then
let's start training it so the only time the head pops out isn't when you're having sex.
Right, and dry. The moisture is what causes some of the yeast and stuff. So.
All right. We're going to take ourselves a little break. God bless you, Devin, for taping the show, and we'll be right back after this. Everybody, it's Loveline. I'm Adam. That's Dr. Drew. Phone number 1-800-LOVE-191. Randy Macho Man Savage in here tomorrow night. Then Kelly Osbourne in here the day after that. Yes, Drew.
About what? I wasn't going to talk.
Producer Ann is very upset.
I don't blame her. I'm upset. I'm flipped out.
How long have you been working with Producer
20 years.
Ann?
Well, no. 15, 16 years?
16 years?
15.
Drew wrote a little something in his book.
Thanking Ann.
Well, it's printed in all the books, right?
Yes, it's in the foreword.
Every book is printed this way. Acknowledgments. And Producer Ann's first and last name is misspelled.
And the first name,
I might add.
First name I apologize for. That I just screwed up. But her last name, I'm convinced is spelled the way I spelled it. How screwed up is that?
She starts it with an I. Drew started it with an E.
But I have handed her name to 1,000 people with that spelling.
That's like 5 or 6 letters off, dude. Maybe more.
No, that's not right. I can't even apologize because I'm convinced I'm on camera
apologize.
You can't
apologize.
No, I'm still convinced it has an E in it.
But let me say this.
I've got to get over that before I can apologize.
I don't mean any disrespect to Ann here, but this is what goes on. There's a lot of Anns who spell their name A-N-N, and then there's A-N-N-Es, right?
Yeah.
It's confusing.
Yeah, that I just screwed up.
Well, it is confusing.
It's confusing.
Not Ann's fault, but I think
I've had to every time I put Ann's name, I have to ask somebody E or not E.
Does and the word Lynn is that way too? Is it not?
Can be.
No, can we disagree on? Let's do it Ann's way, but let's put the E on the end of it and call it a day.
No, she doesn't have the E.
Oops.
I gave her the E.
Oh, you gave her the E.
Yeah.
All right. Now she's going to give you the F.
She is.
Right in the A. Well, the point is Ann has no E on the end of her name.
Right.
Let's just call all Anns that way.
Yeah.
That's what I like to do.
It's a nicer spelling, too, frankly. Isn't it?
However it is, let's just call it that way so we don't get into this. Your wife is Susan. My wife's best friend is Suzanne. They get irate when you mispronounce it, and then they get more irate when I explain to them I don't care. Let's just go ahead and call it Susan. We'll just move forward. I don't expect people that will grandfather in the Suzannes and just
going forward.
Move it from this day forward. There's only Susans. There's no Suzannes, and there's probably a third way of that of pronouncing and spelling that one too. And then of course you start getting into your what is the big one? It's an Angelique, Antique, Andrea. Oh. There's the Andreas and the Andreas, and there's the Taras and the Taras. And you just walked your whole life being corrected. Like, no, that's not the way you spell my name. No, that is the way you spell that name, which is the same as my name, but not my name. And by the way, I'm Tara. I'm not Tara.
Right.
And then I always like the part where people are angry. Do I look like a Tara? It's like, I don't even remember what you are now. Now that we've gone, and once you go back and forth a few times, you're screwed.
Yeah.
That's it.
I'm changing. I've got your name in here as Carolla.
C-O-R?
Yeah, this is
Do I look like a Carolla?
I got to change this. I'm feeling so
I don't
guilty.
care. I personally don't care about that.
You do. You're always complaining about
No,
this.
I complain that publicity shots are misspelled. It just seems like a bad idea to have your own camp misspell your name and send things out. That's why I feel Ann's pain. And let me tell you something. This ain't a dozen roses or a fruit basket.
This is going to take more than that.
This is a cruise. You're going to have to buy producer Ann a cruise. She's going to have to go somewhere far away
I'm gonna have to
and drink exotic wines and forget.
I'm going to have to find all the books that have been sold and scratch out
recall the 17 books you've sold.
Yes.
And scratch out the E. Right?
And change the E to an I.
Oh, yeah, the last name, yeah. Oh, you got a lot.
Okay, I'm sorry. I'm so sorry.
This is a cruise.
It's getting into my head that
it's a cruise.
Wrong.
Natalie?
Yeah. Hi.
You're 20? What's up?
Oh, but before I start, I have to say, Adam, I love you. You are hilarious.
Thank you.
I mean, I wouldn't be devastated if you were a little less disgusting. You know, the pooping in the shower, that's just revolting. But I guess that's what makes you, so I'll have to accept it.
Yeah, that is me. That's me.
Okay, my question is for Dr. Drew. When I eat mango, I get a rash on my lips, and I went to the doctor, and they told me it was from the mango. That's how I found out it was from the mango. And then, but they can't tell me what it's from. Like, she said it might be from a pesticide, or it might be the skin itself, because I can eat the inside. See, and then since then, I've eaten mango, and then one time I was, like, really paranoid. I washed I peeled it first, and I washed it, and then I ate the inside, and I was fine. And then another time I wasn't so careful, and then I got the rash again.
Only mango.
Only mango.
Yeah. And you eat other fruits and things?
Uh-huh.
And what does the rash look like? It's
like a red, bumpy rash, and it burns, but it's
all the way around.
It looks
Does pineapple do anything for you? Any pineapple?
No.
No.
Pineapple doesn't do that.
Uh-uh.
And it's like a ring around.
There's quite a few fruits that burn. Like if I get them on my lip because, like, you know, it's probably just because of like the acid.
Yeah.
But they don't give me a rash.
Okay, and it's a ring around your mouth?
No, it's just my lips, and yeah, it's around, and it's like on the edges.
Yeah.
Your edges crack?
No.
All right. Well, don't eat the mango.
It's like a cheilitis.
For Christ's sake, can you? I could probably make it 20 years without a mango.
Yeah, I don't know that anyone for sure can tell you what that is. I've never heard of that.
But if you think it might be the skin, then wash it real good and stay away from the skin.
The skin is not pesticide. It is something that she's reacting to in the.
Well, she said she did it without the skin.
Yeah.
I love a mango, but you know the problem with mangoes?
They're hard to eat.
The pit is the size of a softball.
Yeah.
What the hell kind of plant is that? It's the world's greatest fruit, but it's all pit, and it's weird hairy pit in there. Hairy pit. It's bad times. But it's good. You know what's nice? Papaya.
Oh, I love papaya. I don't like mango.
Little lime juice on that papaya. Do you get angry at people? I get angry.
There's different kinds of papaya. The Mexican one, there's a Hawaiian papaya.
Yeah. Oh, no. That's just the Mexican papaya. That's just a Hawaiian papaya that's been stolen.
Okay.
That's what they call it there. There's no difference in actual fruit.
Do I get angry at people?
I get angry
like
at people.
Stuff?
No, not that. I get I get mad at the ones that don't like where they go. Roasted almonds. No, I don't care for them. I'm like, what? Yeah, I've tried them a few times. I'm not a big fan. Really, the smoked ones? Yeah, not a big fan. Really? How about the honey roasted cashews? Yeah, not a fan. I'll kill you. But the other one is for me. This happens with fruit. Happens with the papayas. It's like, no, never tried that one. You go,
never tried it?
Yeah, I run into that. Well, everyone out here is from the East Coast.
Oh yeah.
And it's like, never tried the papaya. No, can't say I have.
I have a patient that brings a box these humongous, spectacular Hawaiian papayas. There's one and only one problem with them.
Little lime.
Only one problem.
What's that?
They're perfect. They have to be eaten when they're right.
Yeah.
For about 36 hours.
Yeah.
And then you're just screwed.
You got to strike while the iron is hot.
So I'll eat about 6 of them.
Put a little lime on there.
Oh yeah.
Oh, that is good times. Yeah, do yourselves a favor, everyone. Try this stuff. Yeah. Don't give me that. Never tried that crap. It's all the time. I don't know, people are stupid and they decide they don't like stuff by the looks of it or something. It kind of rubs them the wrong way.
That's the animal in us.
There's
right?
a lot of texture people out there too.
I'm a texture person, but not. It won't cause me not to try something.
Yeah, I don't want someone to chew up a bunch of nuts and spit it into my mouth. Like that's a weird texture, but I can handle peanut butter.
Right.
And people are like,
Stryker won't try peanut butter.
That's a DJ here at the local mother station, K-Rock. Really?
My son, who thought that was the funniest thing he ever heard in his life, is convinced it's because it looks like diarrhea.
We couldn't hang.
Yeah,
can't hang with the Stryker.
Yeah,
can't hang. I mean, for other obvious reasons, there's a difference in class, but also the fact that he won't eat peanut butter. Brad?
Hello.
There's just a clear difference in class. Go ahead, Brad. You're 21.
What's up, Adam?
What's
I just
happening?
want to say you guys rock.
Thanks.
I don't know. I got sort of a question to ask you. It's kind of weird.
Mm-hmm.
Every time I go to have sex with my girlfriend, when I get it in, it seems like I can only get it in halfway. It's like I'm hitting like the back of it, and I'm just wanting to know if there's like a certain depth to the vagina.
Is your girlfriend a small person?
Yeah.
Are you a large man?
She says I am.
No, that's nice.
How about telling us what the dimensions are?
Do what?
Her vagina's about 45, 46 millimeters deep.
Well, no, her vagina should be about yay.
Yeah.
Right? What's that, about 4 inches?
Yeah, 4.5, 5.
Yeah, that's about right. And,
how are you coming in, Brad? What are you weighing in at?
Probably about 160. Last time I weighed myself.
Yeah.
How much does your penis weigh?
I get 10 pounds.
Yeah, like if you did a water displacement test, how much water would be? No, how long are you?
Say roughly about 10 inches.
No.
Roughly about. No, this is bogus.
No.
Brad knows it's bogus.
All right.
First off,
liar, whore, and you know it.
Every guy named Brad's a jack-off until proven otherwise. When I'm in charge, that's what I do. I collect every guy named Brad. There's no criminals named Brad. They're just jack-offs. They're what I would call societal nuisance. I would have a detention center, a work camp, but a reconditioning and work camp. Not just a pure slave labor. Not the guys with the middle name that have Lee in it, or James, like Jesse James. Like all those guys just go get off the street immediately. It means their parents are bikers. Any kid that gives it, we're gonna name him Jesse James. There's no. And by the way, there's no Jesse James Fagin bomb. There's no Jew Jesse James.
Right.
The Jews got more sense than that.
Yeah.
You ever seen like Jesse James Lift Schultz?
No, don't exist.
No, it's just always some dorky goyim.
But for Brad,
yeah.
Again, the depth is about 4 or 5 inches, and it's common to hit the back, even with your hand. When you reach in, you hit the cervix. You feel sort of a donut-shaped, little firm thing back there.
Yeah,
and it moves around. It'll move back and stuff, and it's a good time.
Mm-hmm. All right, let's take a break.
Super early. Come on,
super early.
Here, take this.
Yeah, all right. What time are we supposed to take this break?
38, actually.
38. All right. Well, see, I'm usually late, so I go early once in a while. Josh?
Yes.
You're 20?
Yeah.
Well, we can end the show a few minutes early, too, can't we? I mean, look at it this way.
I got to do the Today Show at 3 in the morning tomorrow.
Hey, Adam, I'm talking.
Miserable. Hey, what's happening? Oh, hold on. We always run, was he talking?
Yeah, I guess.
We always run like a minute and a half late every night.
On this one. Oh, over at the end, yeah. Let's do it on time tonight.
No, let's go now. That's what I'm saying.
We accumulate all those minutes.
Yeah, we get all those minutes logged. I mean, a minute and a half heavy every night. I mean, we average a minute and a half heavy every night.
You're right.
Times 5, that's 7.5 minutes a week.
Oh, they should give us that back.
How about we just end at midnight every night?
Okay, let's end at midnight.
Yeah, but we have about 100 minutes to.
I'd say if it's 7.5 a week, and these are very
round numbers. Yeah,
these are round, but 15. That means 30 minutes. That's 30 minutes a month that we have.
We haven't cashed in on any of that yet.
We got to do that, Josh.
No, we're taking a break now.
Now we're going to be extra fast with Josh. Go ahead.
All right. Well, I tried Trojan, and basically I have a pretty good sized penis, and it's been cutting the circulation off, I think. And it's basically, we go at it, we start having sex, and then it just goes soft.
Hang on a second. You mean you tried Magnums? Is that what you mean by Trojans?
Yeah, I've tried ribbed ones. I've tried all different kinds. And
You've tried
like
the big one.
Tight. And then I went and got these other ones at the sex shop that are large.
Josh will not stop talking.
Well, he won't start listening either.
Yeah,
a combination of both.
Yeah.
Go ahead.
Josh.
Yes?
Did you try the Magnums?
No.
Okay, that's the Trojan large brand.
Those are the big ones.
Yeah.
I tried Lifestyles large.
All right.
And it worked good at first.
Yeah.
And then basically it gets like caught up in like in about the middle of my penis, and like a bunch of it gathers up.
Yeah.
And it feels.
That means it's too big for you. Is what that means.
Well, I'm about 8 inches. Like.
All right. Listen. If you take a sock and you pull the sock up to your calf and then you walk around the room once and it falls down to your ankle, does that mean the sock is too small?
Right.
Or maybe the sock is too big.
Right.
You see?
Yes, he needs something, and it kind of.
This thing is like, well, it slides down to the middle of my door.
Yeah.
Well, that means it's too big. Well, I'm 8 inches.
Yeah, right.
Is there medium? Is there one in between the regular?
Yes, the regular's fine. His fantasy is that he loses the erection because he's having sort of the circulation cut off, and that's not the case. In fact, that holds things in. That's good.
Yeah, I use a sandwich tie,
of
twist
course,
tie,
of
pow.
course. But some guys don't like the feeling. They don't like the break in the action. They do lose their erection when they put the condom on, which is why I'm going to come out with the condom loader. I've decided I've got to come out with it.
Well, good times.
The
Knock
condom.
yourselves out.
Yeah.
I'm going to take a quick break, and so is Drew, and we're going to do it together. We'll be back after this. Hey, yo, it's Loveline. I'm Adam. That's Dr. Drew. All righty, baby. Let's get to them phones. What do you say?
Yahoo.
All right.
Did you do Stern on Friday? Was that when you were worried about that?
Yeah, I did do Stern on Friday.
How'd that go?
That was fine. Jimmy came over at 5:05 in the morning. I go to bed
2:30.
Yeah. Here's my schedule. I normally go to bed about 2 a.m., but if I have to get up for something real early, I go to bed at 2:30. Miserable. And it was one of those things where I took my my alarm and I put it away from the nightstand because it did happen to me one time, and it happens to me once a year, but it happened to me once when I was doing Stern where this buzzer went off after I'd been asleep for about 2 hours. I just reached over and smacked it once, and I was right back into it. And I woke up on my own, though, about 45 minutes later.
Oof, that's scary.
Although, as I was saying, and Jimmy appreciated this because he woke up a couple minutes late and got into trouble himself, it's an interesting ploy because your adrenaline starts pumping so hard. Here's the deal. If you go to bed at 2 and you plan on waking up at 5 to do something, and I'm going to go to bed at 2, I'm going to wake up at 5 because I got to be out of the house at 5:30. You're miserable. Yeah. When that alarm goes off at 5, you're like, holy Christ, I got to kill myself. No, killing myself once isn't enough. I have to. But if the thing goes off at 5:27 or something, you'll pop up. You're not tired.
Yeah.
It's like you heard a prowler break into the house.
Right.
You don't slink down to the stairs. Some junkie's breaking into the... No, you're like, pow. You got this huge adrenaline surge. You're running.
Yep.
And even though it's uncomfortable, you're anything but tired.
Yep.
So there is a certain bizarre strategy to that, and I've done it many times. But, Jimmy was coming over to broadcast from my house at 5 a.m. to do Stern. And he was on this show to about 12 o'clock the night before.
Oh, that's right.
But he'd gone to bed. He said he went to bed at 12:30.
Yeah.
Still getting up at 4:30.
Yeah.
It's like, hey, you got a big 4 hours in, buddy. So he came over. He called me. Said it was going to be a couple minutes late, but showed up, made him a pot of coffee. And we went on and did Stern. And we just did one break. It was like a half hour. But I realized, too, by the way, that I'd been used to doing Stern from 4 a.m. to about 8 a.m. our time, which is about 7 to 11 over there. And it's about the time he's on 6 to 10:30 or 11 or whatever. But the point is,
he does 5 hours.
4 hours, big haul.
Oh, yeah.
I mean, you're seeing the sun come up. You're seeing the sprinklers go on. You're seeing the paper start landing, people going to work and walking and stuff.
A day?
Yeah.
Oh.
Yeah, he does 6 to anywhere 10:45, sometimes 11. Sometimes 10:30, sometimes 10:20, but it can go to 11. And the point is doing that haul from my house from 4 a.m. to 8 a.m. our time is that's weird. You start, after about 3 hours, you just start staring off into space, and then eventually you just think you're listening to the show.
Right.
You got your headphones on, you're sitting in your bathrobe with half a boner, you're in your house, you just listen to Howard and Robin talk, and you just sort of standing there with this glazed look.
Mm-hmm.
Eventually, he'll go like, "What's happening, Adam?" And you'll go, "Why is he saying my name?"
It's like a Homer Simpson dream
it's
scene.
Like, I got to call somebody. He just mentioned my name on the air. But anyway, half hour, easy. Did stay in my head. Had herself a glass of wine, when I was done. Nice glass of wine.
This morning? Or that morning?
Well, whatever, 5:30.
Did you go to work or go to
6?
sleep at that point?
Oh, hell, I went to sleep.
Yeah.
Are you high? Yeah. Well, what am I supposed to do, going to work? What am I doing?
I don't know, Jimmy Show.
Plumbing contractor? It's 5:45 in the morning.
Oh, that morning, yes. I was that, yes.
Okay, buddy. Hey, come on, get with it.
I was thinking you were working.
Oh, 8 a.m.?
Yeah,
no,
yeah.
Still got to.
Yeah.
I'm a puss. I'm not right. I gotta get
I'm
back.
worried about tomorrow for myself. 'Cause I have to go to work.
What time you going? What
3.
time you waking up? 3 a.m.?
3:30.
I'm going to think about that. I may be going to bed about 3. I'm going to think of you. Sean?
Yeah.
You're 21. What's up?
First off, I just got to say, Adam, you know what? You are the man. All right? I think it's a crime that the show is only on for 2 hours a night.
Thanks. We're going to try to get extended to 5 hours, right, Drew?
I'm ready. I'm with you, man.
Actually, there was about a couple weeks ago, you did a nice little impression of a guy named Trevor, and I just got to say that was some of your best work yet, man.
Well, do you remember that?
No, but thank you.
What was Trevor?
Somebody was on the show, and I was playing one of our callers.
Yes, you were.
All right. Well, thanks, Sean. It was obviously one of Drew's favorite moments as well. Yes, Drew?
I remember every moment. That. How could they be a favorite? I get to take in all of this every night.
All right. Go ahead, Sean.
All right. Well, basically, I've been dating my girlfriend for about a year now. I really like her. The thing is, though, every time we try to have sex, I get to the point of penetration, and I barely am penetrating her before she's pushing me away, telling me it hurts too much.
How old is she?
What was it?
She's 9.
How old is she?
She's 11.
She's 19.
19.
Is she a virgin?
I am her first, yes.
All right. Well, yeah,
we've tried, 8 or 9 times now. And
is there hymen in there?
Well, the thing is I listened before to a couple callers, and Dr. Drew just kept talking about go get a pelvic exam, so I told her to do that. I even took her to the appointment. She said everything's fine. So,
well, there's a couple possibilities.
Now we're talking about some vaginismus.
Yeah, and so it makes us think about trauma, like somebody sexually abused her or tried. And
she seems like a really down-to-earth girl, I don't think anything like that happened.
Well, I know what you mean by down-to-earth, but that's probably not totally relevant.
Yeah.
You can be down-to-earth and be a victim, but
that's right.
He's saying she doesn't seem too cuckoo.
Not chaotic, yeah.
Is she get along with... Yeah. She get along with her family okay?
Oh, perfect.
Okay. All right. She seems happy, not uptight, depressed.
No, she's a fun-loving girl.
Sex with Sean.
Mm-hmm. Fun-loving. Now, why was she a virgin? Because of this?
You know what? I guess her mom had her when she was really young, so her mom kind of stressed it to her to, don't go after the first guy you meet kind of thing, and basically, found me.
And her dad wasn't around?
Was that?
Was her dad around?
No, her dad's not around. Well, she still sees her dad every week, but her mom and her dad are divorced.
All right, but dad not around and teenage mom raising you is a little something.
Okay.
Right. All right. It may just be that's making her extra nervous about being intimate, losing her virginity, and you may have to just really go slow with her, and perhaps this is something that will improve with time. She may be having vaginismus, which is sort of a reflexive spasm of the muscles down there, and that's in all probability it is from some sort of pelvic muscle spasming that's causing the discomfort, whether it's from anxiety or vaginismus or something related to trauma. So.
Yeah, listen, you give her some oral sex and don't push the issue.
I agree. Slow.
A glass of red wine and a hot bath doesn't hurt either, yeah? Yes? What? Andy?
Yes.
You're 25?
Yes, I am.
Your boyfriend says she's an active sleeper.
Yeah, I move around a lot in my sleep.
And you're tired. You're tired all the time.
I'm incredibly tired all the time.
Mm-hmm. And you move around a lot. Is it hard? Are you a light sleeper?
No, I'm a really, really deep sleeper.
Your legs kind of jump around?
My legs jump around, I curl up, and then completely stretch back out. I kick people in bed. I roll from one side to the other.
Do you snore?
I kick over the entire bed.
Do you snore?
What?
Do you snore?
No, I don't.
Are you overweight?
No.
All right,
I'm averagely overweight, let's put it that way.
You have a history of depression?
Yes.
What do you mean averagely overweight?
I mean, like, I'm not obese, but everybody's probably about 5 or 10 pounds overweight. Because
How tall are you? How much do you weigh?
I weigh 155.
How tall
and
are
I'm
you?
5'5.5".
All right, hold on. Let me do some radio math. Whew, a lot of fives here. She said 5'5.5".
Yeah.
155. Carry the 2. I got to
penalize the extra fives.
Rough sleeper. Foot. A lot of foot movements in the sleep.
Leg movements.
Leg movements. Okay, I got 5'3" and 15/16, 168.
All right, that still wouldn't make a sleep disturbance.
Okay, I'm just trying to let people know the actual size.
Andy?
Yeah.
One of the things you could do is get a formal sleep study. You go to a hospital and they sort of study your sleep and see what the specific abnormality of the sleep is. And it's kind of sounding like this is going to end up being in the realm of depression.
Well, actually, it probably isn't. I'm leaving out a whole bunch of stuff because I didn't have a chance to tell the screener. I actually have multiple personalities. And it's
all right. Well,
apparently it's switching in sleep, but I'm wondering if that actually has something to do with it.
No. Yes, you're a trauma survivor. And yes, trauma survivors have disturbed sleep. And fatigue is a very common symptom of various psychiatric disturbances.
Is it fair to say the more you've been through and the more that's on your mind, the worse your sleep?
Generally speaking, yes.
So,
especially if it happens bad and it's
That's
early.
great. Then someone gets molested for a while and then God punishes them for the rest of their lives with a horrible sleep disturbance. All right, we'll take a quick break. We'll be right back. Well, that's short, buddy.
Let's get out of here. We said
God
it at
bless
12
y'all.
o'clock.
Yeah, only 30 seconds late. So until next time, it's Adam Carolla for Dr. Drew saying, let's wait till it's only for a minute. Come on.
Wait till 40 seconds. There you go.
Mahalo. Please, eat that tuna. Let him eat that tuna. Let's all get along.
This has been Loveline. The opinions expressed on this show are not necessarily those of the staff, management, sponsors, or this station. The producer for Loveline is Ann Ingold. Loveline is a presentation of Westwood One Entertainment.